Knock, knock, knock.
Hello.
Hello, my name's Candace. I'm going to be your student nurse.
Okay.
Can I get your name and date of birth?
Yvonne Calvert, 5167.
Do you have any allergies to anything?
No.
No allergies. Okay, so today I am going to do a head-to-toe assessment. That's going to be everything from the top of your head all the way down to your feet. And we're going to flip you over and look at your back also. Are you comfortable with your family being in here, or do you want them to step out?
They could step out.
Okay, so the family is going to step out. Okay, so we're going to first start with getting myself there at a comfortable level. I'm going to be looking around the room for IV lines, electrical wires, anything that might be unsafe. Everything looks good. My patient Yvonne is in a good position. I'm going to lift you up just a little bit here. Okay. Do you need to go to the restroom before we get started?
No, I'm okay.
Okay, good. All right. I'm going to just put some gloves on really quick and we're going to get started with examining your head.
Okay.
I know we just took your vital signs. Are you still having no pain?
No, I don't have any pain.
Okay, good. All right. All right, so I'm just going to have you sit all the way forward so I can take a look at your head.
Okay.
Are you able to grab my hand here? I'm going to just lean you all the way forward. Okay, and just do nice palpating of your head. I'm going to look. Okay, there's no abrasions, there's no tender areas. The hair looks clean and well groomed. Okay, I'm going to go ahead and lean you back. All right, so now I'm going to take a look at your eyes. Okay, go ahead and look forward. Okay, checking the pupils. And the sclera is nice and clear. There's no hemorrhages. Can you pull down your eyelids like this? Okay, good. And then can you just follow my pin towards the center? Good. And I'm sorry, I know my hands are a little bit cold. But any tenderness here around your nose?
No.
No? Okay. Okay, I'm going to take a look at your ears, behind your ears for any abrasions or wounds. Good, inside the ears, no discharge or bleeding, no discharge or bleeding behind the ears. Good. Now I'm going to look in the nose. Okay, looks clear and pain. Go ahead and plug one nostril, unplug the other. You're able to breathe well out of your nose. Any sinus problems?
No.
No, okay. Do you wear glasses
Yes.
at home?
Yes, I have contacts in right now.
You have contacts and you're able to take them in and out?
Yes.
Okay, good. How about hearing aids?
No.
No? How about dentures?
No dentures.
No dentures? Okay, go ahead and open your mouth. Okay, mouth looks clear. There's no abrasions, no sores. All the teeth look intact. Go ahead and smile. I'm checking for facial symmetry. Good. You're able to stick your tongue out and we'll just take a look at the back one more time. Good. Everything with the mouth looks all right. Okay, and then we're going to go down to your neck. Okay, I'm going to, sorry my hands are cold, but I'm going to go ahead and feel your carotid here. Nice and strong and regular. Nice and strong and regular, making sure I don't do them both at the same time. Okay, I'm going to take this minute also to use my stethoscope to listen to the carotids. Go ahead and hold your breath for 2 seconds. Good. And again. Okay. There's no bruise. Okay. And when I palpated the carotid artery, I didn't feel any thrills. Okay. Now we're going to move down. The trachea is in line. And I'm going to take the chest here and make sure that the skin trigger is good. Okay? How are you doing so far? Good. Good. All right. So I'm going to listen to your heart sounds. I'm going to have to expose your chest here. I'll let you know if I need you to do anything. I'm going to first start with a aortic heart sound, and that is going to be your second intercostal space on the right sternal border. Okay, now I'm going to listen to the pulmonic, which is straight across on the left sternal border, second intercostal space. Okay. Then I'm going to go down to the third intercostal space for my tricuspid. Oh, Erb's point, sorry. Okay, and then the fourth for my tricuspid. Okay, I'm going to have you lift your breast so I can get the mitral, which is at midclavicular line, fifth intercostal space, also known as the apical pulse. Okay, thank you. Okay, now I'm going to go on to your lung sounds. Are you still comfortable? Are you warm? Good. Okay. Oh, all right. So I'm going to start again. I'm going to, every time I put my stethoscope down, I'm going to have you just take a nice breath in and out. Okay? I'm going to first start at my right sternocleidomastoid. Okay. Okay. Left sternocleidomastoid. Second intercostal space at the sternal border. Second ICS at the right sternal border. Okay. The fourth intercostal space, right sternal border, across to the left sternal border, fourth intercostal space. Okay, and then we're going to pull this down just a little bit and go fifth intercostal space, sternal border, and again here. Okay, and I'm going to come around and do your side here. I'm going to lift up your gown about that. I'm going to do fifth intercostal space on the side. And then on this side. Thank you very much. Okay. Now we are going to, now you sit all the way up. Okay. I'm going to listen to your back in a butterfly position or pattern. My 8 spots. Okay, then I have you lean back. Now I'm just going to take a look at the chest. Your chest has been rise and fall. It's equal. Okay, and now I am going to move on to your extremities. Okay, I'm going to have you go ahead and grab my hands here. Got your hands. Okay, I'm going to have you go ahead and push up. Okay, go ahead and push down. Good. I'm going to check calf refill. Okay, calf refill looks good. Okay, I'm going to go ahead and check your pulses. Okay, the radial is equal bilaterally. I'm going to go ahead and check your brachial. Okay, equal bilaterally. Okay, can you just go ahead and look that way, and can you just let me know what finger I am touching? My right ring finger. And how about here? My left ring finger. Okay. And I believe that's it on your arms. Okay. Oh yes. Can you please lift your arms and above your head? Sure. And go ahead and go down. And then can you go out a little bit? Okay, does everything feel good there? Okay, good. All right. And then we are going to, I'm gonna do your abdomen here. I see that you have an IV. We're gonna do the assessment after because I have an order to take it out.
Oh, okay.
Okay?
Oh, good, yeah, it's fine.
Go ahead and pull this up a little bit. Okay, you comfortable like that?
Yes.
Okay, the first thing I'm gonna do is I'm gonna take a look and everything looks symmetrical. Any abdominal pain?
No.
When was your last bowel movement?
This morning.
Okay, and everything was normal?
Yes.
Okay. I'm gonna listen to the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay. I'm gonna palpate a little bit here, so just let me know if there's any pain. Okay. When was the last time you urinated?
About an hour ago.
Okay, does this have any pain or discomfort here in your bladder?
No.
No? Okay, good. And I see you don't have a Foley catheter or anything like that. Okay? Okay, now we're gonna move to your legs. Okay. I'm going to remove the socks. I'm gonna take a look at your feet. Okay. Can you pull back? Good. And can you push down? Good. I'm gonna do some cap refill. Good. Are you able to lift this leg up at the knee? Bend at the knee? Good. Go ahead and put it down. The same with this leg. Go up and put it down. Okay. What am I touching here?
My right toe next to my pinky.
Okay. And how about here?
My big toe.
Okay. I'm gonna listen, or I'm gonna feel for the fetal pulse. Okay. Okay. Now I'm gonna feel for the posterior tibial. Okay, I'm gonna feel for the popliteal. And if anything's abnormal with these ones, then I would feel for the groin. I would feel the groin for the femoral. Okay, that all looks good. Skin overall, general appearance, patient looks good. There's no wounds or sores. I'm gonna definitely be taking a look at the back of the heels here. Okay. All right, now I'm going to have you. You doing good so far?
Yes.
Okay, I'm gonna have you roll to your side. I'm gonna take a look at your back. Okay. Okay, no skin breakdown, no pressure sores in the sacrum. Look all the way down. The back of the heels look good. Okay, we already did your breath sounds back here. So you could come on back. Overall, my patient's been answering all my questions appropriately, so I could say that they are A&O ×4. I'm going to set you up here. Next thing I'm going to do is take out your IV.
Okay.
I have an order for it that I just checked. Okay. So I'm going to pull the tape towards the IV catheter so that I don't accidentally dislodge it. gonna hold it for 30 seconds. I'm gonna inspect the tip and make sure it's intact. If I need any type of culture of the IV tip, then I can have a specimen container, but right now I don't need a culture. Okay, so I hold it for about 30 seconds. Okay, if the patient's on anticoagulants, it's 5 to 10 minutes. Okay. Okay, so once that's on, I'm going to put my IV catheter in the sharps container. Okay, I'm going to get a clean, fresh piece of gauze. And a piece of tape. Now, if your patient is actively still like oozing, then you're gonna have to move a little bit faster than me. Obviously, I didn't really poke Professor Calder. Okay. You want to double up your gauze, kind of have like a nice pressure on it, and it will get tricky with the gloves, but. Then I take my gloves off, hand hygiene, clean my area. Okay. I'll lower my bed back down. Make sure my patient's in a comfortable position. Okay, my rails are up. Any other questions?
No.
Good. Your call lady's here at the side. If you need anything, let us know.
Okay.
All right. Have a good day.
Thank you.
All right.